Nakuru County.
All right, so we've looked at the situations in Kisumu and in Nakuru, but what about what was happening right here in the capital, Nairobi? Caroline B was out and about taking a look at how the operations in various hospitals in the city were paralyzed. Let's take a look at her report now.
Solidarity forever.
Songs of solidarity came in handy to make good the intentions of a go-slow. A strike, they say, will be the biggest in history, with both nurses and doctors defiant of calls by various stakeholders, including the Ministry of Health, to hold talks and return to work.
I will not call off this strike until the collective, harmonized collective bargaining agreement, harmonized, that is the term, harmonized collective bargaining agreement is one, signed by the government. Two, government keeps commitment from the treasury that there is money to fund this CBA. Three, SRC writes a letter saying it is not going to rush to court. It has allowed for the CBA to be implemented. And four, the CBA is actually registered in court.
We are determined, and we have the resolve of our members to go to the end until the CBA is implemented.
And as a result, services came to a standstill at various public hospitals, including Mathari Hospital, where several mental patients were reported to have fled the premise. And after announcing their intentions to continue with the strike, they headed to Afia House to seek audience with ministry officials who were holed up in a meeting at the time. It is at this point that they met head-on with the law enforcers, forcing them to disperse, their next stop being the National Treasury. The doctors and nurses have been pressing for a pay increment and harmonization of allowances, but the government maintains it has no funds to meet their demands.
To the mwananchi of this country, we want to say that you have gone through sorrow. The doctors have equally gone through sorrow. This is the time for the Kenyan and the doctor to unite and end their sorrow.
We know that the government has money. When we were discussing and negotiating this document, all the relevant ministries were included in the negotiations. Therefore, we are wondering at what point did we reach for the government to say that we are not ready to sign this CBA, which was negotiated between the same government and the same union.
Talks between the health workers, governors and ministry officials reached a dead end after the government requested for more time for the negotiations. Patients are now left in agony, with their loved ones lamenting all the expenses they have to incur at private hospitals for their treatment. No one knows how soon they will get help. Caroline B, KTN News.